Okay, this video is part 3 of Erasing Dr. Mcdougall's Legacy. Part 1 was the interview with Nathan Pritikin. Part 2 was the story about rebuttal of Dr. Greger's criticism of potatoes. Part 3 here, I'm going to have a link to Dr. Mcdougall's interview with Dennis Burkitt, but I first want to explain to you why Burkitt was more correct than you realize. A lot of new information has become available since those days that strengthens the accuracy of what Burkitt was saying and the support for the Dr. Mcdougall diet, the low-fat vegan diet. Okay. So Dennis Burkitt was from Ireland. He was an Irish general surgeon. That means he operates on the abdomen, on the bowel, the pancreas, and the liver. And he was a Christian missionary who did his Christian mission in Africa. And he was a brilliant man. He mapped out the pattern of acquiring the disease, a type of cancer called lymphoma that became named after him, Burkitt's lymphoma. And he became pretty famous after that, and he got put in charge of hundreds of hospitals mapping out their disease patterns. And the thing he became most famous for was for mapping out abdominal pressure syndrome. He did that work in conjunction with another doctor named Peter Cleve and Hugh Troll, and also with a scientist, PhD, Alec Walker. And it was rather incredible stuff. If you want to read a quick paper about it, Dennis Burkitt and the Origins of the Dietary Fiber Hypothesis. This is a good one by John Cummings. Here's a nice picture from Dennis Burkitt's lectures. And basically this is from a lecture given by Dr. Mcdougall, but he's talking about the work of Dennis Burkitt here. And what Burkitt said is that when you have small stool because you're constipated from a lack of dietary fiber, the people are going to be sick, the population, and you're going to need big hospitals. On the other hand, if people eat a lot of fiber, they'll have bigger bowel movements and they're going to be healthy, so you only can get by with small hospitals. That was the gist of that. Okay, now Dr. Mcdougall also used to say, you can see the truth. You don't even need to do all this reading. Just open your eyes and look around. Papua New Guinea, where they ate 93% of their calories from sweet potatoes, they're all skinny, muscular, and energetic. Okay, they do a tremendous amount of physical labor, physically fit. And that's interesting because sweet potatoes are only 4.5% of calories from protein, so super low in protein. Average Papua New Guinea man eats 25 grams a day of protein. That's only a fourth of the average American man who eats about 100 grams per day. Okay, you really don't need hardly any protein. In all the animal studies, you know, the less protein the animal eats, the longer they live. The lower the amount of protein in your diet, you protect your kidneys. You also lower your risk of cancer. You lower your risk of activating mTOR and accelerating your arrival at the Hayflick limit. Okay. Other thing about Papua New Guinea, despite the fact they smoke like chimneys, they had 6 times lower lung cancer than Americans. And that's thought to be because their diet's so low in fat. Sweet potatoes are only 1% of calories from fat. They're like a bunch of skinny muscle men. So that's what Mcdougall meant. You could see the truth. People who eat this way, these low-fat starch diets, they're really skinny. Look at all the Chinese. Before 1975, they're eating about 85% or more of their calories from white rice, which has only 1% of calories from fat. They're all skinny. You won't ever see a fat one. I lived in California for 4 years. Okay, back in the 1980s when I was in college, I never saw a fat Asian person. Not one. All my Asian friends are all skinny. Okay, here's one of the books about Dennis Burkitt. This one by Brian Kellogg. I've read the other one, and I'm going to show it to you in a minute. So I don't know this one, but I read the book by Dennis Burkitt as well. Anyways, Burkitt was in Uganda about 17 to 20 years. Population of about 10 million. He said he only had to take out 1 gallbladder for gallstones. In the USA, general surgeons are taking out a couple every week. Okay, in an area that big, they'd be taking out multiple every week. Okay, there was next to 0 colon cancer. He had a friend who was a surgeon in Africa for 38 years and he had only 1 appendicitis. Again, same guy in the USA would be taking out an appendix every week. Okay, no hemorrhoids, close to 0, Burkitt in his experience out there. So a totally different pattern of diseases than what he had seen when he was in Ireland, than what he had seen in Ireland and England. Now this was a very good biography of Dennis Burkitt. It's called How a Humble Surgeon Changed the World. Dennis Burkitt was a great man, and he was brilliant, and he was really nice and really humble. The more you read about Dennis Burkitt, the more you will like him. Okay, here's abdominal pressure syndrome. Basically, when you eat high fiber it pulls water into the stool, and that softens the stool. So when you defecate, it comes out like a cow patty. Because it's bulky from the water being added to the stool, it stretches the walls of the rectum, and therefore the rectal wall has a reflex contraction. And, when the rectal sphincter opens up, you just defecate out. It's effortless, okay? In comparison, that means you don't have to strain when you have a bowel movement. It just comes right out quite easily. On the other hand, if you're constipated, you don't need enough fiber, the stool is dry. So a high fiber person is pooping out something rather similar to a rather similar to a cow patty, versus somebody eating a low fiber diet is pooping out Tootsie Rolls or goat pellets, hard little stool balls. Those do not stretch the rectal wall very well, so the person has to strain their abdominal muscles a little bit, tighten up their abdominal pressure. That's called a Valsalva maneuver. And then that back pressure is transmitted to the abdomen, pops the stomach into the chest, hiatal hernia, associated with gastroesophageal reflux disease, GERD. You get inflammation of the esophagus called Barrett's. Eventually that can lead to esophageal cancer. Okay, you got dry stool balls on the right side of the colon. They can plug up the appendix. Lith means stone. Appendical lith is a stool ball stone in the appendix, also called a fecal lith, like fecal stone. That blocks the appendix outflow. The mucus glands keep secreting. They can't get the mucus into the cecum, the remainder of the colon over here, so this will pop. That's appendicitis. Back pressure on the sigmoid colon, outpouching of the muscular wall. That's diverticulosis. One of them pops. Diverticulitis. Stool spills out into the mesenteric fat, the fat around the colon, causes tremendous pain. I see cases of that every week, okay? A little bit less often as appendicitis, but it's still a common cause of acute abdominal pain. Back pressure can lead to increased inguinal hernias, increased periumbilical hernias. I couldn't draw the one on here. Rectal hemorrhoids, varicoceles in the scrotum, back pressure down into the leg, varicose veins, all this trouble just because you're constipated. And that is what Dennis Burkitt knew, back around 1970 when he was first met with Dr. Mcdougall. And what I'm going to tell you is fiber does way more than that. It has tremendous importance, far more than you can imagine for like everything, okay? All right, now here's just a quick picture of leaky gut. Basically, here's normal gut over here. You eat fiber, the good gut bacteria convert the fiber to short-chain fatty acids, in particular 4-carbon butyrate. 4-carbon butyrate is taken up by the gut lining cells called enterocytes because the gut's called the enteric tract. They use the butyrate to make TJs, tight junctions, and that blocks everything that doesn't belong from getting through that gut wall. If the tight junctions are not intact, then bad things get through the gut wall. LPS is bacterial endotoxin from gram-negative bacteria. It means lipopolysaccharide. When that gets across the gut wall, it'll cause inflammation of the gut wall. It can get into the blood over here, and then it can cause inflammation in the blood and a lot of problems. We're going to talk about that. There's also big chunks of protein can get through, cause molecular mimicry, and then the immune system reacts to it. You can get autoantibody cross-reactivity and autoimmune disease. Okay, it's a major mechanism of autoimmune disease. And the main thing that prevents leaky gut is to eat adequate amounts of dietary fiber. At a minimum, you should be getting at least 50 grams a day. Ideally, you should get even more than that. I probably eat about 100 grams a day. Dennis Burkitt says our ancestors ate over 100 grams a day of fiber. All these things listed here, things like alcohol, chlorine in your water, Al in your water, F- in your water, all these emulsifiers in processed food, all these oils, okay, saturated fat, they all increase your risk of leaky gut. Okay, excessive psychological stress, caffeine, sleep deprivation, all of those things increase your risk of leaky gut. All right, so now I'm going to start showing you some of the reasons why that's a big deal. You want to protect your gut barrier, okay? Your gut barrier is a big deal. It's like guarding the fort of your body. And same thing with your teeth, your gums, periodontal disease. Bacteria can get across there, and those bacteria get into your blood, they start causing problems. Okay, so here is showing the LPS bacterial endotoxin from gram-negative bacteria. Gram-positive bacteria have an endotoxin called LTA, which does much the same things. It's not as extensively studied, though, in the medical nutritional literature. Okay, you also get excessive amounts of iron. You become iron overloaded from all the refined foods that have iron added or from the meat. And those will distort the shape of this clotting protein called fibrinogen and make it change from alpha helix like a slinky or a cylinder. Secondary protein structure is alpha helix, and will make it into beta-pleated sheet, which just means flat. So now, it's hard to stack a bunch of Slinkies. It's very easy to stack a deck of playing cards, which is the shape of the protein when it's like a beta-pleated sheet. So they stack up, they bind to each other, and then the bigger the molecule, the more likely it is to precipitate out of aqueous solution, which means blood plasma, to clot. And so you get lots of blood clotting, and this will plug up small arteries, and it can make you stupid, and it can weaken your heart. It can cause all kinds of problems. The other thing is these high-fat diets will have a tendency to activate the neutrophils. Neutrophils are the vast majority of your red blood cells. I'm sorry, not of your red blood cells, of your white blood cells. They're about 65% of your white blood cells. They are the first responders to infections or bacterial toxins in the blood. The LPS will activate them, pathogen-associated molecular patterns. These are all the toll-like receptors. And guess what? TLR is for toll-like receptor. It's also activated by dietary fat. Okay? Not good. The neutrophils will first release their granules, things like MPO, myeloperoxidase, and that'll cause some trouble. We're going to learn about that in a moment. But even worse, the neutrophil will sometimes go ahead and release its nucleus. It'll release its DNA and try to throw it like onto a bacteria to immobilize it, but it gets confused by the LPS. Okay? And you start getting more activation of these neutrophils to undergo netosis, meaning spontaneous release of their DNA into the extracellular space, and it is a bad thing. The combination of DNA plus histones and other proteins is called chromatin. So this is called decondensation of the chromosome, meaning unwrapping it and then throwing it out like a fishing net. And they're trying to trap a bacteria with it, but all kinds of bad things happen. You can now start forming autoantibodies to it, like anti-double-stranded antibody in lupus, anti-citrulline protein like in rheumatoid arthritis, anti-cardiolipin antibody like in lupus. You can get anti-neutrophil cytoplasm antibody like in ANCA vasculitis. It predisposes to clotting. It can activate the platelets. All kinds of trouble starts happening. Okay, you don't want this, and it worsens your high blood pressure. It forms blood clots in other locations. These are the kind of things that could plug up small arteries in your brain, make you stupid, plug up small arteries in your heart, and damage your heart. Okay, just some quick papers here. I'm not going to go in much detail, but AL will cause leaky gut. It'll also kill gut lining cells. It also causes brain damage, and that's in your tap water. Okay, that's why you want a reverse osmosis filter. Okay, that's why you don't want leaky gut either. All right, there's more things going on here. Here's Roy Swank's book, and he had shown how especially saturated fat dramatically increased the risk of getting multiple sclerosis. He also wrote papers on how it decreases oxygen delivery to tissues and damages tissues. A great video by Dr. Roy Swank is at Dr. Mcdougall's site, where he shows how the fat clumping onto the red blood cells through the chylomicrons and through LDL cholesterol creates blood sludge, and that drops oxygen delivery to the tissues. In a hamster brain, he measured like a 30% drop in oxygen delivery to the tissues. Peter Cohen measured 20% drop in oxygen delivery. Here's a little bit about neutrophil release of MPO, myeloperoxidase. Myeloperoxidase is a heme-containing enzyme that catalyzes the production of bleach. Just like, bleach, the product for bleaching clothes, it's used to kill bacteria, okay? It sort of combines chlorine with hydrogen peroxide to make HOCl, hypochlorous acid, okay? And neutrophils are the main thing that releases it. Okay, that's going to be pretty important because MPO is very cationic, meaning it's very positively charged. Endothelial glycocalyx is very negatively charged. So when the positively charged MPO drops on the endothelial glycocalyx, endothelial cells are the lining cells of arteries, it collapses them down. So it damages the glycocalyx. Beneath the high, tall glycocalyx are, the glycocalyx is all negative charge. It has a zeta potential. Normal red blood cells have a zeta potential. Normal neutrophils have a zeta potential, which means a negative charge so they don't stick together. But MPO trashes the negative charges. And then you're going to be stuck having these adhesive molecules exposed above the now collapsed glycocalyx, and you don't want that. You're going to start getting neutrophils adhering to the endothelial cells, you're going to start getting red blood cells adhering to the endothelial cells, and you're going to start forming clots. You don't want that. That's all bad. So why am I going through all this? Because the point I'm trying to make here is, if you just eat your fiber and do what Burkitt and Mcdougall said, you avoid all these problems. Burkitt and Mcdougall, they did not have this information about. They just knew these patients who eat a lot of fiber, they are healthy. Okay, what I'm showing you here is the reason why they're healthy. Besides avoiding abdominal pressure syndrome, they avoid netosis, they avoid myeloperoxidase release, they avoid damage to the red blood cell outer plasma membrane and glycocalyx, because the red blood cells will get distorted in shape. An acanthocyte just means a few spikes in the contour of a red blood cell. Echinocyte means diffuse spikes in the contour of a red blood cell. These deformed red blood cells are less able to deliver oxygen to the tissue, so the tissues suffer from a relative hypoxia. You also have problems with these high-fat diets that it damages the plasma membrane in red blood cells. They start undergoing something called phosphatidylserine externalization. That means the phospholipid phosphatidylserine, which normally is primarily in the inner leaflet of the plasma membrane, will start more rapidly flipping into the outer leaflet. Okay, and then when that gets into the spleen, that's like an eat me sign. It makes the red blood cell less deformable, and these red blood cells are cleared more rapidly in the spleen. And when they try to pass through capillaries elsewhere, they're stiffer. They don't get through as well. Okay, and you can also run into problems where when you have an excessive amount of these things going on, the phosphatidylserine can activate the RAGE receptors, the receptors for advanced glycation end products, and this also will lead to inflammation, and it's damaging, and it's prothrombotic. So these are things causing more clotting in the blood, making your blood more higher viscosity, increasing your risk of hypertension, increasing your risk of atherosclerosis. This is all bad. Okay, here's one paper by Roy Swank, the neurologist, friend of Dr. Mcdougall, another one of Dr. Mcdougall's mentor. And this is when he was working in a hamster brain, okay? And it was producing significant reductions in the available amount of oxygen. And it was due especially to the saturated fatty acid. He thought saturated fat was by far the worst. Later researchers also proved, like Ray Rosenman and Meyer Friedman, that omega-6 cooking oils were also very bad and damaging for oxygen delivery to tissues. They also cause blood sludge. Okay, here's one paper showing exogenous fatty acids from the diet, endogenous fatty acids from being obese. They will also activate toll-like receptor number 4, just as does LPS, lipopolysaccharide bacterial endotoxin. So, that's a pretty bad statement that excessive dietary fat is being associated with the same thing as bacterial endotoxin, okay? That's bad. Major depression disorder patients have increased LPS antibodies. So there's a sign that leaky gut could be associated with that. Okay, here's just also showing the effect on estrogen. When you eat a high meat diet low in fiber, you get more of the so-called bad bacteria. These are bacteria that produce more of an enzyme called glucuronidase. That ends up being a problem for estrogen metabolism. Normally the body takes excess estrogens. They go through the liver detox system. Liver is a big metabolic workhorse to detox chemicals in the blood. And it conjugates the estrogen. E is for estrogen. And then glucuronic acid, just think of it as being a glucose with a carboxylic acid on there. Okay, and this is what it adds to it. So the estrogen is then excreted in conjugated form into the bile, goes into the bowel, and you defecate it out of your body. That's how you lower estrogen levels. And what I'm saying is when you don't eat enough dietary fiber, you get more of the bad bacteria from a meat and processed food diet. They deconjugate the estrogen. They cleave the connection between the estrogen and that glucuronic acid. Now the estrogen is reabsorbed into the blood. And this is another reason why American women who eat these processed food diets have very high estrogen levels, which increases their risk of breast cancer, increases the risk of uterine fibroids, increases the risk of endometrial cancer. It's bad. Increases the risk of autoimmune disease, increases the risk of becoming fat. You've got high estrogen levels when you're pregnant because it signals to the body, it's a fat storage hormone, to save extra calories, keep them on the body because the baby might need those for energy. Okay, so here's kind of the point I'm making. Dennis Burkitt was correct when he said dietary fiber patients who eat adequate amounts are much, much, much more healthy. And he and Mcdougall both knew this to be completely true based on epidemiology of Africa and everywhere else that they looked. Jeff Nelson over at VegSource has a very good quote. He says, "Fiber is life, pharma is death." That is totally true. And the reason I just showed you these slides so you realize when you eat the high fiber diet and avoid the processed food, avoid the meat, avoid the oils, You're not just protecting your gut from abdominal pressure syndrome. You're protecting yourself from leaky gut. So you're protecting yourself from autoimmune disease. You're protecting yourself from amyloid clotting. You're protecting yourself from LPS activation in neutrophils to undergo netosis. You're protecting yourself from LPS traveling up to the brain. When you got leaky gut, you tend to have leaky blood-brain barrier. You're protecting yourself from neuroinflammation. It's all good. You're protecting yourself from microvascular ischemic disease, atherosclerotic disease, plugging up small arteries with amyloid clotting, plugging up small arteries with netosis-related clots. You don't want any of that, okay? And you're also going to be more likely to avoid, iron overload and all the complications that go with that, which includes amyloid clotting. And like I'm saying, the difference between low-fat vegan diet versus an animal diet or a processed food diet, it's not a close contest. It's not 5-4. It's 100-0. The only bad thing about the low-fat vegan diet is you got to take B12. Okay? That's it. Animal food, animal protein, processed food diets, they're associated with everything bad. Bad gut bacteria, like I said, increased estrogen reabsorption, all the inflammatory bowel disease, irritable bowel syndrome, abdominal pressure syndrome, obesity, autoimmune disease, hypertension, diabetes, coronary artery disease, peripheral vascular disease, stroke, dementia, kidney failure, osteoporosis. It's all bad. It's all bad. Who would want that? So anyways, I'll have the link in the description below for the Dr. Burkitt interview. I've just given you a little bit of background information with this talk. I hope that was helpful.